Hello, my name is Tom Kerber, and I am the owner of Kerber USA and a couple other companies. My background is 40 years in electronic development, and the last 18 has been involved in the medical space. I actually started working with high power light 18 years ago with my very first product, which was for the dentists to use for curing the white fillings. You just set the setting on the here, and it would time out, and there's a high power LED on the end, and you just drop it into this holder and charge up the unit that way. And that was on the market, called the Blue Wand. But through that, I learned all about LED technology and how to increase power levels in that. And we developed then other lights that was involved in, first was in using very high power light for cancer, and where we'd activate a photosensitive drug. And then from that, because of an experience, I fell from a second floor from a ladder and ended up on my behind, really hurting my back. And every 2 years, year to 2 years, I'd have this serious pain in my back. And so what happened was, on one of these occasions when I had this high power light for the photo activation of the drug, I decided I'd just try just the light only on my back. I wouldn't have believed it, but I thought, what the heck, I'm in so much pain. And I put it behind my chair. And when I did, I worked away on my computer stuff. And about 20 minutes later, I was able to I was able to stand up, and I could hardly believe I could stand up and even bend over and touch my toes. So my pain went like from an 8 down to a 2 in 20 minutes. So from there, I realized that PBM light, as you've been learning, is super for reducing pain and inflammation and a whole host of speeding up healing. So I've developed a number of different light technologies. So even 15 years ago, I developed this particular light called the Genesis Health Light. And this device would put out a fair amount of light energy, and that light energy would be used to, again, reduce pain and inflammation. And then continue down that vein to continue to improve on these different types of light technology, where I've developed a bed and other things. And about 2 years ago, I realized that the need of having a light that could do the whole body. So I developed this light behind you here, and I can turn it on, and a person can treat their whole body under this. It's absolutely beautiful. Feels like you're out on a warm summer day. And then from there, I've been just 2 weeks ago, I've been approved by Health Canada to do a COVID trial. And with that COVID trial, we can use light to shine on the lungs and decrease the inflammation in the lungs. This happens to be the device that we're approved to use. It is a fairly large area that you can see using high power LEDs. And we can in this case, we're going to be using the 810 nanometer, which is this light. It's near infrared and penetrates really deep and would shrink the inflammation in the lungs. So we've got that approval in the way, and we're going to have multiple centers using that light for reducing inflammation with a 40-person trial right now. So in the dental area, I've been in the dentist chair lots of times, seeing the needs that they have, and more recently, the last 2 years, developed this product, which is the Palm. So this is the Palm unit here. And the neat part about this device is that we're FDA registered now. We have multiple different products based on LED, and especially in the dental side here. It's really small, but don't let that fool you. There's a lot of light power behind this, and there's a lot of areas. You can see the size of my hand. So there's 2 different wavelengths that come out of this unit, and that allows for a very deep penetration, and there's also benefits to the 660 nanometer. There's a lot of good success stories that we've seen with people using us for different applications outside of the dental, but you've heard all day about all the great stuff that you can do in dental. And it runs off a low voltage power adapter that just plugs into the base of the unit like that. and there's no batteries that you have to worry about replacing or anything like that. It's very, very safe, and it's very light, and it's durable. And there's various built-in safety features. It's got a 1-year warranty. So just mentioned the tool wavelength, 660 nanometer or 810. The power on this particular version is 5,500 milliwatts of power at 660 nanometer and 3,500 milliwatts in 810. A substantial amount of irradiance at 137 milliwatts per square centimeter at the 660. And at 810, we're looking at 87 milliwatts. And that allows for you to have a very quick delivery of 4 joules in a very short amount of time. And I'll get into that a little later on. The treatment area is a total of 40 square centimeters, which is really key for this kind of device, because now instead of treating a minute here, a minute there, 30 seconds there with a smaller light device, you can treat all those areas at one time and do that in less time because of the light that's delivered. So we can deliver out of this unit 4 joules in 30 seconds. So in 30 seconds, you could deliver 4 joules to all of those different areas. And even at 810 nanometer, we can do that in 46 seconds. So that saves a lot of time. Instead of 3 or 4 spots in a minute each, you can do all of them in 46 seconds. Runs off an adapter, UL approved, and there's safety stuff in it. Here's an application treating the masseter for TMJ and the temporalis muscle up. So it covers such a large area. And it's such a beautiful multi-purpose device that this could be your take-home too when you have other injuries on the home front. And so if you have carpal tunnel, it's very easy to treat and just take this home with you. There's a lot of light power here with the 5,500 milliwatts and the 3,500. There's a high safety, and that's because the light is diffused. It's not one little tiny spot. It's almost like if you got stepped on by a very wide heel, somebody wears a standard running shoe, they could step on your toe and it's not going to be too bad. But imagine what would happen if you did that same thing and a woman had a stiletto on and she happened to step on your toe. That area is so small, it really increases the pain or the light intensity in this case, because it's such a small area, where this is treating such a large area and it's diffused. This is very lightweight, and that's because I got some patent pending technology that I figured out how to make it reduce its weight, and yet there is a fan inside this unit that keeps it cool so that we can have such a high power in such a small package. High output power, and you're looking at 50,000 hours use. So like before you even reduce like 10% out of the light power. Now, I've also got a brand new design that allows you to put this into there and make it universal. And you can now use your tip and have the light going right through the tip. You can see it there. It's going right through my hand, my finger. Okay, so here's a comparison between a laser source, and this is the whole idea of, on the top 2 pictures, you probably can see that there's really not much difference at the look of my finger on the left and my finger on the right. The finger on the top left has an LED below it. You can see that in the lower picture. We really reduced the power in this case to take this picture. But the power is exactly the same as what you see on the right side. That's one of my meters there, and it's showing that I've got 3 milliwatts of light power in both the left-hand side and the right-hand side. And what you can see by that is that it doesn't matter whether you have 3 milliwatts coming from an LED or you have 3 milliwatts coming from a laser. But if you can see on the bottom picture on the right-hand side, you can see how that LED or that laser will produce a very hot spot in that one, like it's all there, right? But on the left-hand side, the light is diffused over the area. But that does not change how far the light penetrates. Optical power, once it reaches the top layer of the skin, has so many photons. Those photons will go and get scattered. And that's why the left-hand picture and the right-hand picture are the same. So if we multiplied the power level by 100 times and it goes through a deeper portion of the body, you won't see any difference between a laser and a light device that's based on LED power. But the safety is there. You can see on the left-hand side, 660 nanometer is actually penetrating right through my cheek. And on the right-hand side, you can see that this is 810 nanometer. 810 not only passes through the cheek, but you can see it actually going through the gum line. So 810 nanometer has great benefit for deeper penetration, and 660 nanometer has additional benefits to do with the blood. Here's an example of, although you don't have to wear glasses in using this, for comfort and just a little additional safety, sure, wear some glasses, but it's not like a laser. So if you look at the left-hand picture of the finger, you got the light spread over the whole finger. But unlike that, on the right-hand side, you have that power on one spot. So you literally could be on the other side of the room, and if a laser is used, you could damage somebody's retina because that spot stays the same size as it continues to go to the other side of the room. A laser keeps that focus to one little spot, but when it comes to PBM, there's really not much more additional advantage of having a laser. Laser will work, but in this case, the safety factor of an LED device is really premium. So here we go to the benefits. You have that large area. You can do 4 joules in 30 seconds, 46 seconds for the 810 nanometer. There's a large area, very cost effective and powerful. And I feel that we really reasonably priced this device, and it's a premium device with higher output power than anything out there. So the applications, you're looking at post-operative pain, acute pain, facial pain. As you guys have been learning today, TMJ, TMD, you'll be able to improve the healing time. I had one person that had jaw surgery and they had bone implant done, and they went back to their surgeon in 2 weeks, and he was just like, I can't believe this. You have 4 weeks of healing in 2 weeks. But as you've been learning today, light can be tremendous on speeding. So dry socket, orthodontic pain, you can move the teeth faster. You can really reduce the need for opiates or pain medication or totally get rid of them. You can reduce the inflammation sometimes right then and there and eliminate the need for local anesthesia. And hey, you can use this at your practice and take it home when you sprain your foot or you hurt your hand or you cut yourself. So here's a video.
Hi, Tom. I just wanted to make this little video and let you know what I've thought about your light. As you know, my TMJ has been pretty much in a lockjaw mode for about 2 years now. I did go to the oral surgeon. I was on amitriptyline, 50 milligrams, and I also went to my arthritis doctor as I figured maybe this is my arthritis reacting in my jaw. He prescribed a muscle relaxant. So since using your light, to be honest, the first week I was doing really well. I was 3 times a day regularly. I'm using my little guide to measure my jaw. So that's as big as I can get. I started at 3 centimeters opening. Right after the first 15 minutes of having the light on the muscles on this side and under the jaw, I was up to 3.3 millimeters. So 15 minutes later, it felt like I was opening really wide, but it did feel like the muscles were relaxed right away. So over the days, I was getting further and further along each day. So in the overnight, I guess I'm clenching at night. That would exacerbate it a little bit. So I was going from 3, I'd get to 3.3, 3.5 by the end of the day with 3 treatments, and then overnight I'd slip back to 3.2. The next day, after starting at 3.2, I would get to 3.6 and then slip back to 3.3. So small gains, but for me, the big thing was I can feel these muscles relaxing.
Okay, so this device, the dental version, the HPD8, is available at a special price of $975 US, and that's a $200 discount. And for the first 10 that purchase this light, I will include one of the new devices that allows you to now do a treatment that way inside the mouth easier. And we have 3 models that we have. We have the classic model, which is an entry-level device. That won't work with this special adapter, but it does help with pain and inflammation, and the introductory price is $650. This is the most popular unit, this one here. And like I say, I'm including this new attachment. This one is our mid-range unit, and it's $975. And for those that want to go for the ultimate, I mean, those that are the top 3% that want all the power they can get, I have the same version as what you have here, and I'll also supply it with the extra adapter. But that one there is $1,300, and it's 50% more power than this mid-range unit, and it's there as well. So for the first 10 people that purchase one of the this one or the ultimate, they will get this $150 attachment, and that's for those who order today. I will have this available down the road, but you'll have to pay the extra money. Anyways, thank you very much. I'm very pleased. I'll answer any questions that you might have.